Good evening, everyone. Welcome to OET Listening Prowess, and this is Devida Benny from 𝐒𝐿's Academy. How are you guys? We are back after a week, and today I've come up with part C of OET Listening. Last week we had a session on part B of OET Listening. I can understand that you're having your exams coming this week, so എന്തൊക്കെയുണ്ട് preparations ഒക്കെ proper ആയിട്ട് പോകുന്നു എന്ന് വിശ്വസിക്കുന്നു. So I'll just wait for a few minutes so that others can join. Then we'll start the session right away. Meanwhile, the question will be displayed on the screen for you. Okay, so as you know, part C, we have 2 extracts, that is 6 questions each, and today we'll be discussing a presentation. As you know, part C il namukkariyam presentation undavum, interview type undavum. Presentation is something which most of you find quite difficult. So we'll be discussing the presentation today. So for the presentation, you might find difficult while they switch from one question to another question. So I've discussed this several times on our previous session. When you get a presentation, please listen closely to the audio and try to find out when the speaker is actually switching from one information to the next information. So the question is displayed on the screen, so please just go through the question as of now, then we'll be starting the session right away. Good evening, Divya. Okay, let's start with the session. So first question here is indicating, what does Dr. Paul recommend as a crucial step alongside new medication in managing diabetes? So adinum you can see this is a presentation which is of Dr. Lisa Paul, and the conversation is of the advancements in diabetes management. Okay, first question, as I already mentioned, tell me regarding whether it is an attitude or opinion from the question. So the question is stating, what does Dr. Paul recommend as a crucial step alongside the new medication? So tell me regarding whether it's an attitude or the opinion. Let me know regarding the same. Is it an attitude or opinion from the question? And do state the reason as well. Okay, so here we have few keywords over here. The first one we can check in as the crucial step, and another one we can add is alongside the new medication. Okay, so what is the question actually stating? Here we can understand that is an opinion. Okay, can anyone let me know regarding why it is an opinion? Is there any particular reason behind why did you choose this as an opinion? So we can see the word recommend over here. So it is very evident that it is the Dr. Paul who is actually recommending this crucial step alongside new medication to manage the diabetes. So here the word recommend is stating or indicating a specific judgment about what should be done in this diabetes management. Okay, so practically speaking, Dr. Paul is suggesting that he is actually trying to provide guidance based on the expertise rather than expressing his general belief or his feeling. So as I already mentioned, do not underline each and every single word which is present over there. We just have to mark the keywords. So crucial step is actually emphasizing the importance. Then we can see the alongside new medication, which is actually indicating complementary to the medication. Okay, so as I already mentioned, that's going to be an opinion. Why it is an opinion? Because it is Dr. Paul who is actually recommending this crucial step. So opinion is a personal belief or a particular judgment. So here Dr. Paul is the one who is actually recommending this medications to manage the diabetes. So what according to the question is stating is that medication is not actually sufficient, and he is asking us whether is there any particular changes that should be made, which means whether is there any lifestyle changes should be made, maybe that can include a diet and exercise, which should play a vital role in managing the diabetes effectively. So ensure that while you listen to the audio, you have to find out the exact answer what they're trying to include over here. Okay. Now, let's move on to the next question. The next question is stating, how does Dr. Paul feel about the role of personalized dietary plans in diabetes management? So that is your question. So tell me regarding whether it's an attitude or an opinion, and also do comment whether there is any particular keyword that you would like to include over here. Please do mention regarding the same. Is there any particular keyword that you would like to include over here? Is there any keyword? Keywords will be very beneficial for you. Okay, keyword will be very beneficial for you to understand the exact method to find out the answer. Okay, so as we were discussing question number 32, so the question here is stating, how does Dr. Paul feel about the role of personalized dietary plans in diabetes management, right? So tell me regarding the keywords which you would like to include, and tell me about whether it is an attitude or opinion of the speaker. Accordingly mention regarding the same. So here from the question, what do you understand? So here the it is clearly mentioning regarding an emotional stance or predisposition towards the personalized dietary plans. Here it is clearly mentioned regarding the same, and this is actually reflecting his underlying beliefs about their importance in improving the treatment adherence. So why this is an attitude? Because it's an emotional stance, okay, and it is also showing a more generalized view rather than a specific recommendation. Okay, so as you know, attitude is something is emotional stance, and here that is clearly showing his emotional stance and is reflecting the beliefs which he is having on the personalized dietary plan. And the keywords, what are the keywords? Is there any particular keyword? The keyword here we can include is feel about and the personalized dietary plan, which can help you, and always ensure that you mark keywords only on the question rather than on each options. Yes, Sony, role of personalized. Okay, is there any other keywords would you like to include? So as I just mentioned earlier, he is emphasizing the personalized dietary plan, which can help their patients to stick to their treatment regimes and making them more effective in managing the condition. So while you listen to the audio, try to find out the actual role or how the dietary plan or personalized dietary plans in diabetes management is going to help each patient. So accordingly, try to find out the question. Okay, and we have three options. They are often too complex for patients to follow. They are essential for improving the treatment adherence, they should be avoided in favor of generic diets. So as we already know, the conversation is happening about diabetes management. You will be able to listen to the same regarding each question, what they are trying to include about the management. Okay, so try to find out properly regarding the attitude, opinion. Now let's move forward with the next question. So the question number 33. According to Dr. Paul, what type of exercise should patients prioritize for effective diabetes management? So that is your next question. So now tell me regarding the keywords over here, as well as the attitude or opinion the speaker is proving towards the same. Read your question properly and let me know regarding the same. So this question, we can understand that's going to be an opinion, right? According to Dr. Paul. So why opinion? And it is also, it is suggesting a specific recommendation on what type of exercise the patients should prioritize. So basically it is indicating that Dr. Paul is expressing a particular viewpoint based on his knowledge and experience rather than merely stating a feeling or any belief. Okay, type of exercise, yes, that is a keyword. Any other keywords? You can actually mark here the prioritize, which is also going to be helpful, and go through your each option. So if you notice this word, you can directly understand that's an opinion stated from or by the doctor itself. So it is clearly his viewpoint regarding whether this exercise is going to be prioritizing the effective diabetes management. And also he is advocating here regarding the physical activities which can be more sustainable and which will also help to maintain long-term engagement. Good evening, Vandana. Okay, now let's move forward with the next question. So what is Dr. Paul's stance on continuous glucose monitors in diabetes care? And we have three options again provided. So tell me regarding the attitude or opinion this one is stating over here. Is it an attitude or an opinion which is mentioned from the question? It is mentioning what is Dr. Paul's stance and the keyword as well. Let me know regarding which is the particular keyword that you would like to include over here. Is there any particular keyword you want to include? Okay, so here you can see that's going to be an opinion, right? Why opinion? Because you can understand that it actually implies a firm viewpoint of Dr. Paul, because what is Dr. Paul's stance on continuous glucose monitor, which means if there is another person who is taking a stance on continuous glucose monitor in diabetes care, he or she can mention another viewpoint regarding the same, right? So the perspective can be changed, and also Dr. Paul's perspective on the CGM is empowering the patient to reflect a specific opinion about their role in diabetes management. Okay, so basically it is indicating a judgment rather than any emotional attitude. Okay, so the keyword that you can use over here is the stance. Then we can see empower patients, which is also reflecting a positive look to the technology. So here Dr. Paul is supporting the use of CGM as they are providing valuable data, which is also helping the patients to make any informed choices about their health, which can lead to better management of the diabetes. Okay, so the whole point should be clear regarding the question. So when you read the question, reread the question twice, try to understand the meaning of the question, go forward to find out the meaning of each options, and understand whether it's an attitude or opinion. Try to mark the main keywords. If possible, try to focus on the keywords while you listen to the audio. So there are certain, and as I already mentioned, as it is a presentation, while they move forward from one question to another question, you will have small pauses in between. If you are closely observing to the same, you will be able to listen to that fine close pauses, and while they move from one question to another, you can hear them using certain sentences, maybe like, let's move on to the next topic. So which means you can understand the speaker is actually moving forward to the next one, where that is indicating that they are going to be moving forward to the next question, or maybe next I'll be speaking about the same. So you will be able to listen to this very fine sentences that they will be placing in between, and it will be helping you to give or get an idea regarding the information that you can include. So when it is a presentation, always ensure that you are going for the signposting language and also paraphrase, meaning you are very aware about the paraphrase sentences that you do have in part C. So when you get the question, if possible, try to understand the meaning from a very different way, which is of the paraphrased meaning. So if you get the question, try to understand what the speaker is trying to provide. Okay. Now let's move on to the next question. What concern does Dr. Paul express regarding the use of technology in diabetes management? So that is your next question. So tell me regarding the keywords and whether it is going to be an attitude or an opinion from each question. So the question is, what concern does Dr. Paul express regarding the use of technology? So basically, he is having certain concern regarding using the technology in this diabetes management. Okay. So again, which one do you think? Is it going to be an attitude or an opinion? Do let me know. Is it going to be an attitude or an opinion? It's going to be an opinion, right? Why? Because you can see the term concern over here, right? The concern itself is actually suggesting an emotional reaction, right, to the potential issues which is surrounding the technology use. So which is actually reflecting Dr. Paul's feeling about the challenges a patient can face with technology. So basically is actually trying to provide any specific recommendation to the same. So now the keyword one that I've already marked, that is concern. Anything else? You can already go for the use of technology over here. Good evening, Reba. Good evening. We're just continuing with the discussion. Please go through the question. Yes. So what is the question stating here, as we just discussed? So basically, Dr. Paul is worried that many patients is not receiving sufficient training, maybe to use this diabetes management technologies effectively, which can hinder the potential benefits. So try to understand the question and then go forward with each option. Basically, attitude and opinion. So here it is clearly stating that's an opinion because it is his concern. So if there is some other person who is having or dealing with a particular if they are having any concern regarding the use of technology, that might be another one. Maybe he or she might not have any concern about the particular condition as well. So it can change, it can vary. So you have to try and find out which one is going to be necessary. Okay. Okay. Now let's move forward with the last question. That is, how does Dr. Paul envision the future of diabetes care? Now tell me whether that's going to be an attitude or an opinion. Is it going to be an attitude or an opinion? How does Dr. Paul envision? Envision means future possibility, or you can say imagine. So it is having a very specific viewpoint over here. So which one do you think? Is it going to be the opinion or an attitude? Here we can use the keyword envision, then future of diabetes. These both can be used as a keyword over here. Is there any particular, yes, Reba, it is opinion, very good. Why opinion? Because as I already mentioned, it is actually implying a specific viewpoint about the future. should look like, right? That is his viewpoint about the future of diabetes care. And Dr. Paul's focus on personalized medicine, and he's also trying to focus on preventive strategies which can help. Okay, so he is actually foreseeing a future in diabetes care which can prioritize the personalized treatment plan, and along with that, preventive strategies rather than any one size fits all approach over here. So again, how does Dr. Paul envision the future of diabetes care? So far we were discussing regarding the whole extract, how you can try to understand whether that's an attitude or an opinion, and also the mark the keywords as I mentioned earlier. And as it is a presentation, try to closely observe regarding the same, whereby may ensure that you're reading your background information to get an idea regarding what actually they are speaking. Here they are discussing on the advancements in diabetes management. So that itself will get you an idea regarding the conversation through what is going to happen. So use your reading time properly. As you know, you will get 90 seconds, right? Rather than sticking onto the instruction, ensure that you are starting to read your question from that point itself, which itself will give you another 10 seconds, maybe like you'll get another 1.5 minutes to read the question itself. So ensure that you're reading the question from 31 to 36. By the next time when you start reading the next set of question, you can start reading from 36 to 31 and get an idea regarding each question and each option. While you listen to the audio, try to find out the distractors. As you know, in part C you will get the distractor. What is a distractor? A distractor is something which will deviate you from your correct answers. So ensure to focus on these things and try to listen to the same. So now I'll be playing the audio for you. Listen to the audio and try to find out the answer. Then we'll come back for the discussion.
Questions 31 to 36. You hear a presentation of Dr. Lisa Paul, who is discussing on advancements in diabetes management. You will hear two different extracts. In each extract, you will hear health professions talking about different aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation of Dr. Lisa Paul, who is discussing on advancements in diabetes management. You now have 90 seconds to read questions 31 to 36.
Hello everyone, I'm Dr. Lisa Paul, and today I'd like to share some insights into the current advancements in managing diabetes, particularly type 2 diabetes, which has become increasingly prevalent in our society. Over the past decade, we've seen significant progress in how we approach this chronic condition. One of the most notable advancements has been in the development of new medications. Among these, GLP-1 receptor agonists have emerged as a game changer. These medications not only help lower blood sugar levels effectively, but they also promote weight loss, which is crucial for many patients suffering from obesity-related complications. But managing diabetes effectively goes beyond just medication. It's imperative to adopt a holistic approach. This means incorporating lifestyle changes, particularly in diet and exercise. Recent research highlights the importance of personalized dietary plans tailored to individual needs. For example, some patients may thrive on low-carb diets, while others may benefit from a balanced approach that includes all food groups. The key is to create a sustainable plan that patients can adhere to in the long term. In addition to dietary changes, physical activity plays a vital role in managing diabetes. Regular exercise can enhance insulin sensitivity and help maintain a healthy weight. I often encourage my patients to find activities they enjoy, whether it's walking, cycling, or swimming, as this makes it easier to stick with a routine. Now, let's talk about technology and its integration into diabetes management. Continuous glucose monitors, or CGMs, have transformed how we manage blood sugar levels. These devices provide real-time data, allowing both patients and healthcare providers to track trends and make more informed decisions. For example, if a patient notices a consistent rise in their glucose levels after certain meals, we can intervene promptly to adjust their treatment plan. However, despite these advancements, challenges remain. Many patients, especially older adults, may find technology daunting. It's essential that we provide thorough training and support to help them become comfortable with using these devices. Ongoing education can empower patients to take charge of their health and improve their outcomes. Moreover, accessibility is a significant concern. Many of the latest technologies and medications can be expensive, making them unavailable to some patients. As healthcare providers, it's our responsibility to advocate for our patients and seek ways to make these resources more accessible. Looking to the future, I am optimistic about the continued evolution of diabetes management. Advances in personalized medicine, including genetic testing, hold great promise for tailoring treatments to individual patients. We may soon see a shift towards more proactive and preventive approaches, focusing not just on managing diabetes, but on preventing its onset in at-risk populations. In conclusion, managing diabetes effectively requires a comprehensive approach that includes medication, lifestyle modifications, and the integration of technology. As we move forward, it is crucial to ensure that all patients have access to the resources and support they need to lead healthier lives. Thank you for your attention, and I look forward to the future of diabetes care together.
Yes, so we are done with the audio. So how was it? Was it easy for you or were you finding it difficult? Did you find it difficult? So let's move on to discuss the answers, right? Okay. So for the question number 31, the answer was B. Now question number 32, the answer was B. Were you able to get the answers correct or did you get any of the answers as wrong? And now question number 33, it was again B. And 34 was also B. Then we have A as answer for 35. And finally, C is the answer for 36. Did you get all correct or is there any particular question that you have missed? Do let me know. Is there any particular question that you missed? It should be easy because the audio was not going to be that difficult for you. Okay, let's move on to discuss the answer. I hope this was easy for you. So yes, for the question 31, what does Dr. Paul recommend as a crucial step alongside new medication in managing the diabetes, right? See, the answer was B. So here, while you go through the transcript, you can see Dr. Lisa Paul is actually trying to her insights on the advancements of managing the diabetes, particularly the type 2 diabetes, right? And she is trying to explain regarding the prevalence in the society about the same. And while we come to our answer, here you can see the medication not only help lower blood sugar levels effectively, but they also promote weight loss, which is crucial for many patients suffering from obesity related complications. What was our question? Question was, what does Dr. Paul recommend? Which means alongside the new medication, is there any particular options or any management that is there to help with the diabetes? So here we can see, I've highlighted the answer for you. Managing the diabetes effectively goes beyond just medication. So which means just with the medication, it is not going to be managed effectively. They have to they have to adopt an holistic approach towards the same. What is that particular holistic approach that they have to adopt? So which means they have to incorporate lifestyle changes which has diet and exercise into the same. So here the question was, what was the crucial step alongside new medication? So it is clearly stating alongside new medication there should be the lifestyle changes which is in diet and exercise. That is something they have to include apart from the medication. So that is how we come to the answer for question number 31, that is the B. Okay. Now question number 32. The question was, how does Dr. Paul feel about the role of personalized dietary plan? So which means, what is his opinion regarding the personalized dietary plan in diabetes management? And our answer was B, right? Here it is clearly stating some patients may thrive on low carb diet, which while others may benefit from a balanced approach which include all food groups. So the key is to create a sustainable plan that the patients can adhere to the long term. In addition to dietary changes, the physical activity plays a vital role in managing the diabetes. Okay, so here they are essential for improving treatment adherence. Adherence means to follow. Okay. For the first question, while we eliminate the particular answer, there is no particular information regarding limiting patient access to medical advice. Is there any limitation that should be done, should be given? No, right? Then increasing the dosage of medication. Here it is clearly mentioned on the previous question, medication not only help lower blood sugar effectively, but they also promote weight loss. So that is what here mentioned. So here first option was, they are often too complex for the patient to follow. Is it mentioned regarding that it is going to be very complex for the patient to follow? Here it is clearly stating recent research highlights the importance. The research is highlighting the importance of personalized dietary plan to the individual needs. According to a person's individual need, we can tailor the particular dietary plan. So some patients, whereas while we take a group of students, some patients may thrive on low carb diet, while others may benefit from a balanced approach. Okay, so which also include all food groups. So particularly means some of the patients might be having an okay towards the low carb diets, whereas some patients might find it difficult with a balanced approach. So what is the key? Key is to create a sustainable plan that patients can adhere in the long term. So the key one is, if they are following the food groups, balanced approach, everything, if they are adhering to all these things, they will be able to manage the diabetes management. So personalized dietary plan is really important. So that is what it is clearly mentioned. Physical activity plays a vital role in addition to dietary management. So they should be avoided in favor of generic diet. Is that something which is mentioned? No, they are clearly stating it should be avoided. They are essential for improving treatment adherence. So the personalized dietary plan which will help you to together with the treatment, and that can be helpful. So each person will have different viewpoint regarding the same, and regular exercise can enhance insulin sensitivity and help maintain a healthy weight. So regular exercise will also help them. So basically, if they have this diabetes, what they have to follow, they have to have a dietary plan, along a personalized dietary plan, which they can include all type of food group which will be benefiting. Okay. Next question, while we move forward to the next question, is it all audible now, Anita? I hope it is clear for you now. Okay. So the next question is, according to Dr. Paul, what type of exercise should patients prioritize for effective diabetes management? So basically the question is there any particular type of exercise they should be prioritizing to have a proper diabetes management, right? So our answer was any form of physical activity they enjoy. Okay, while we go through the transcript, you can see that I often encourage my patients to find activities they enjoy, whether it is walking, cycling or swimming, as this makes it easier to stick with a routine. So what does that mean? So which means the doctor is actually encouraging his or her patients to go forward with whatever he finds is enjoying, whether it is walking, cycling, anything, they are okay with it. So it is not a high intensity interval training. We can actually clear cut the same because that's going to be a distractor. Only exercises recommended by healthcare providers. No, the question is according to Dr. Paul. So Dr. Paul is the one who is actually mentioning regarding the same. So that is why we come up with the answer for question number 33, that is B. Okay. Now let's move forward with the 34. So what is Dr. Paul's stance on continuous glucose monitor in diabetes care, right? So what was the answer? The answer was B, right? They empower patients to make informed decisions about their health. So here, as we discussed earlier, we are asking about Dr. Paul's stance on continuous glucose monitor, right? Okay. Let's talk about the technology and the integration. Continuous glucose monitor have transformed how we manage blood sugar level. So these devices provide real-time data, allowing both patient and healthcare providers to track trends and make more informed decisions. So they should be used only in hospital. Is it mentioned something like that the patient should be, or it can be only used in hospital? No, it is not mentioned regarding the same. So we can eliminate the same. They are too complicated for the average patient. Is it mentioned something like that? No, that makes it two distractors. So what is here mentioning? So basically it is mentioned that with the help of CGM, or it has actually transformed on how to manage the blood sugar level, and this devices actually provides a real-time data which is allowing not just patient but the healthcare providers to track the trends and also make more informed decisions. So which is actually benefiting both the patient as well as the healthcare providers to get or understand what exactly is the or how it can help in the diabetes care. Okay. So now let's move on to the next question. What concern does Dr. Paul express? So here, while you listen, you can understand the Dr. Paul is going to express regarding his concern regarding the use of technology. Okay, so we can see, for example, if a patient notices a consistent rise in their glucose level after certain meal, we can intervene promptly to adjust their treatment plan. However, despite these advancements, challenges remain. Many patients, especially older adults, may find technology daunting. It is essential that we provide through training and support to help them become comfortable with the devices. So what are they speaking about the technology? They are trying to mention that here we can mention that many patients, especially older adults, may find the technology is quite daunting or finding it quite difficult. So it is really essential that they have to be thorough with the training and support before they start to use any technology, and so that they can become more comfortable with these devices. So our option was the rapid advancement of technology is overwhelming for patient. Is it overwhelming for every other patient? Is it mentioning like that? No. They are specifically mentioning that especially older adults. So when you take a group of patient who does have this diabetes, there might be a group of patient that is older adults who is having this or who is finding this technology quite daunting or whatever they are mentioning, or here the option is overwhelming. Here if it is mentioned regarding rapid advancement of technology is overwhelming for older adults, then you can actually tick that answer. But here it is clearly mentioned it is overwhelming for patients. It is not clearly stating regarding whether it is an older patient or if that is we can't generalize over here. That makes it wrong. Now, technology increases the cost of diabetes management. Is it something like that is mentioned? What they are mentioned? Despite this advancements, challenges remain, right? And what are they trying to communicate in the later part? Ongoing education is actually empowering the patient to take charge of their health and improve their outcomes, right? Now, they are also mentioning medications and technology can be expensive, making them unavailable to some patients. So, it is only unavailable for some patients. Again, if it was unavailable for every other patient, that can be a concern that Dr. Paul might have expressed over here. So that is not, it is mentioned. Now, if we read the next sentence, it is our responsibility to advocate our patients and seek way to make these resources more accessible. So looking to the future, so here onwards, they are actually going forward with the next question. So what were they speaking in this entire part? They were trying to explain regarding or Dr. Paul's concern regarding the use of technology. So what was his concern? His concern was many patients was lacking adequate training to use these devices effectively, right? So it is essential that we provide thorough training and support to help them become comfortable with these devices. So if there is a lot of, especially for the older adults, who does have the diabetes. And as we already mentioned, the option B is incorrect, as it is generalizing here, stating that the rapid advancement of technology is overwhelming for every other patient, and it is not clearly stating that it is overwhelming for every other patient. It is just for some patient. Even though technology increases the cost of diabetes management, it is mentioned technology is increasing the cost of diabetes management. Here it is mentioned many of the latest technologies and medications can be expensive, making them unavailable to some patients. So just because of technology, there is not going to be an increase in the cost of diabetes management. Whoever is not able to manage with the help of technology, they can stick to the traditional methods, and whoever that does have an availability or that does have an opportunity to deal with the diabetes management can stick on to whatever they are currently having. Okay. Now the next question is, how does Dr. Paul envision the future of diabetes care? As we just mentioned earlier, what is the meaning of envision? Can you just tell me regarding the same? Envision here means what exactly it is mentioning, the future perspective, right? Okay. So looking to the future, I'm optimistic about the continued evaluation of diabetes management. So from the line, it is stating that he is actually optimistic about the same. Advances in personal medicine include genetic testing, hold great promise for tailoring treatments to individual patients. So basically he's telling if there is an advancement in personalized medicine, how it is happening only with the help of genetic testing, which will help to find out the hold great promise for tailoring treatment. We may soon see a shift towards more proactive and preventive approaches. So they're telling soon they can see some more approaches towards the same that will not just focus on managing the diabetes but also preventing its onset at its risk population. So that is not just going to prevent that will only, with the help of the preventive approaches, we will not just help to manage the diabetes, but also it will also help to prevent the onset. Okay. Now, in conclusion, managing diabetes effectively requires a comprehensive approach, which should include medication, lifestyle modification, and integration of technology. So, what is the conclusion that they are trying to say? If they have to manage diabetes effectively, they require a comprehensive approach, which means medication alone is not going to help them. They would require medicine, now lifestyle modification, integration of the technology. All three things will help them to get the management. Now, it is crucial to ensure that all patients have the access to the resources and support they need to lead healthier lives. And it is also mentioning that while they move forward, it is also crucial, or it is also important to ensure that every other patient is having the access to each and every other resources and support that they need to lead a healthier life. So coming back to the question, how does Dr. Paul envision the future of diabetes care? So what is his vision on the future of the diabetes care? A shift back to traditional treatment method. Is he mentioning that? No, he is clearly stating it is crucial to ensure that all patients, so basically whoever is not or whoever is actually sticking with the traditional method, they also should get an opportunity to manage the same with the help of technology. All right. Now, a focus solely on medication. No, that's again wrong. We can actually eliminate that answer because it is clearly mentioning medications, lifestyle modification, and integration of technology. So that's a balance between three options. They have to have medication, lifestyle modification, and integration, and emphasized on the personal medicine and preventive strategies. Yes, that's where the answer lies. Where is that? Here it is clearly mentioned. We may soon see a shift towards more proactive and preventive approaches, focusing not just on managing diabetes but on preventing. So we may soon see a shift. So that means in future we can see another shift, another change towards more proactive, more active, or more effective method on how to prevent the diabetes. So the approach is going to be helping. That is not just on focusing managing the diabetes, but also regarding how we can prevent this onset regarding the condition. Okay, so that's how it is. So as I already mentioned, while you go through the part C, ensure that you are able to read each and every other question. Do you have any doubt about the same? If you have any doubts, do mention in the comment. I'll be explaining it for you. Do you have any other doubts regarding the same? If you find part C difficult, ensure that you are listening to the podcast which is there. Try to write the script which is available. That will be also helping you to improve your part C, and also stick on with the accents. That can help you to get the answer to an extent, especially for the part C. As you know, if there is only a person who is speaking, which will be helping you. Is there any particular question that you would like to ask? Is there anything else? I hope it was clear for you. So we'll meet next week. Till then, good night, guys. Thank you.